Michelle Kelly, and I'm a clinical psychologist and senior lecturer at the University of Newcastle. This module will cover changes in behaviour that we see that are associated with dementia. Specifically, we will cover what are the changes in behaviour that we see, when and why do we see these behaviours, how can we best manage these behaviours, and where to get more support. So firstly, what are the changes in behaviour that we can see in a diagnosis of dementia? Firstly, due to the changes in thinking skills, so due to changes in memory and judgment and concentration, we can see behaviours such as confusion, where the person might become overwhelmed quite quickly, usually by things that wouldn't have previously bothered them. They may appear to overreact, and they may also become repetitive. So either in what they say or in what they do. For example, they might follow you around or yell out to you when you've left the room because they might have forgotten that you told them that you're just going out the back for a few minutes. They may also start needing some more direction in terms of sort of behaviours that they're trying to action, such as trying to make a cup of coffee. And this is due to changes in planning and organisation functions of the brain. We might also see changes in mood and social skills and personality. So where they might have been an outgoing person in the past, they might have started to withdraw. They might have difficulty understanding their own emotions, but also others' emotions. And this means that you might see changes in their ability to be able to be empathic towards you or to show gratitude. And this can be quite hard often for families. You might also see changes in their ability to provide to self-care. So this is in their ability to wash themselves, feed themselves and dress themselves. And this again is often a function of the changes in thinking ability. So planning those actions, recognising when they might need to wash or change clothes. And also physical changes in behaviour. So how they move about, but also how they sense their environment. So they might get lost in their environment, or they might run into things because they're unable to sense the world as they once did. When and why do we see these behaviours? So our behaviours occur in response to things that we see, hear, touch and smell in our environment. Each part of our brain is responsible for different skills, and the diseases and conditions that cause dementia affect different parts of the brain. So here in this image, we can see the front part of the brain, the red part, is responsible for planning and organising, as well as our social skills and decision making. The temporal lobe is more responsible for long-term memory. The parietal lobe for working out where things are in space around us. And the occipital lobe is for processing visual information, and the cerebellum for our balance and coordination. So as the disease makes changes to these parts of the brain, we see changes in behaviour. So sometimes the behaviours that we see are a direct response to the changes in the brain, but sometimes the behaviour may be related to these changes outside of the person themselves, so within their environment. So this might be changes in the living environment. It also can be caused by changes in medication or in their health more generally, such as experiencing pain. So how can we best manage these behaviours? So firstly, it's important to say that this is one of the things that families often find the most difficult, particularly changes in social functioning. So the ability to socialise and communicate with others, but also recognise emotions and respond appropriately. So keeping in mind that this is difficult to manage, and we'll talk in a moment about the support you can get. But first thing is to stay calm. So if you're in the moment and the person is becoming frustrated or maybe even angry and aggressive, the first thing to do is to stay calm. Also to speak quietly yourself. So if your voice gets ramped up, then that's going to even escalate the situation more. Get support or help if needed. So if you feel in danger for any reason, get support and help. Call someone to come and help. And the other important thing is to take respite. So it is difficult to try and manage these changed behaviours and the way that they change over time. So make sure that you're getting the help you need and the support you need. So one way we often try and work out the cause of the behaviour or the how we can change the behaviour is to look at this trigger behaviour reaction pattern. So we know what the behaviour is. That's the thing that we're having often trouble with. What triggered that behaviour? So what happened just before the behaviour? Was it that they saw something in the environment that made them think of the particular thing that's caused the behaviour? So one example is for a person that's no longer able to drive, just seeing the car keys in the kitchen might prompt them to say, I'm going to go for a drive, I want to drive now. And that's, of course, a difficult behaviour to manage. We also look at the reaction. So whether your emotional response or what you're actually outwardly doing might make the behaviour sort of worse or happen more often, but also what's happening for the person with dementia. So their emotional response can also make the behaviour happen more often. But the first step is really trying to work out what that trigger was. And that can be something that's really difficult to do on your own. So what I'd say is always look for additional support. Talk to your GP about some of the changes because sometimes it can be medically caused. The National Dementia Helpline and their website is also a helpful place to go. But also if you'd like more support in terms of managing the distress associated with providing care for someone with dementia, but also help with how do we change the behaviours so that they're not so problematic, you can contact the University of Newcastle Psychology Clinic, where we can take you through a manualised program that helps with these aspects. So you can do this via either in person at Callaghan or Ourimbah at our clinics, or via telehealth. We can take you through the program that way. So keep in mind these are tough things to deal with and you should seek support where you can.